Viewers, I am Arun. Welcome to our Facebook live session with VF Hospitals. Today's topic is colon cancer and its treatment. As March is Colon Cancer Awareness Month, it is a great time to discuss the importance and success of colon cancer screening. Colon cancer is the third leading cause of cancer-related deaths, but screening with colonoscopy decreases this risk by over 65%. Anyone over 50 should schedule their screening and encourage their friends and family to do the same. Today, we have with us a reputed medical oncologist, Dr. S Nithya, practicing at VS Hospitals, Chennai. Dr. Nithya specializes in medical and pediatric oncology. She has handled complicated cases with ease. One of her main focus is on screening and prevention of cancer, which could eventually help in reducing cancer burden. She is also an avid learner and loves to keep herself updated with the latest advancements in the field of oncology. To add to her list of achievements, Dr. Nithya was awarded with the Dr. Gayaraj Ayyanadar Gold Medal for Pediatrics and Professor K. Ramachandra Endowment Gold Medal for Medical Oncology. Also, Dr. Nithya likes to paint and rhyme whenever she finds time. Even that is rhyming. Nature being her favorite muse. Welcome, Dr. Nithya. Thank you for joining us today.
Thank you, Mr. Arun, for the kind introduction.
Before we begin our discussion, Dr. Nithya, will you tell our viewers a little about yourself?
So I'm Dr. Nithya. I'm a medical oncologist practicing in VS Hospital. And my main interest in oncology are the focus is mainly on breast cancer and the gastrointestinal cancers. And I also have a special interest in pediatric oncology and consistently treat patients, pediatric patients with cancer. And prevention and screening is one of my favorite areas of oncology, because we know that prevention leads to a reduced cancer burden, and screening reduces it reduces the stage in which the cancer is detected. So early diagnosis leads to a better cure rate. So my main focus now is on prevention and screening for preventable and cancers, and those which can be screened and detected earlier. So that is one of my key interests. And I've been practicing medical oncology for about 10 years now. And we've seen a lot of great advances in oncology. And the latest one being immuno-oncology, where we have a lot of immunotherapies in the management of cancer, colon cancer including. So that is one of the most exciting things in the decade. So that's a lot of focus on that. And I have a special interest in immuno-oncology as well. So that's it. That's about me.
Great, Dr. Nithya. Dr. Nithya, to start with the first question, what is colorectal cancer? Can you educate us?
See, colon, as we all know, is the medical term for the large intestine. The main function of the large intestine being absorption of water from the food that passes through the intestine. So what is rectal cancer then? Are they the same entity, or they are two different things? So rectum is the distal part of the large bowel, and that is the commonest site of colorectal cancers, because they are biologically biologically behave similarly. Meaning the treatment, outcome, diagnosis, everything is going to be the same. They are clubbed as colorectal cancer. So we don't find colon cancer anywhere in our statistics. We always find it as colorectal. And unfortunately, rectal cancer is the commonest site of colorectal cancer. So most of our patients of colorectal cancer we see in our clinic are diagnosed with their primary tumors in the rectum. And there is no specific, there are a few differences in the management of colon cancer and rectal cancer, but the outcome remains almost the same. So that's why they're called as colorectal cancers. We have seen a huge rise in colorectal cancers over the past 10 to 15 years. They were nowhere in the top 10 about 20-25 years ago. Owing to our very wonderful dietary habits, we have managed to bring colorectal into the top 5 cancers. And as Mr. Arun has already told, it is the third leading cause of death. worldwide. The top two being lung cancer and stomach cancer. Stomach cancer is now overtaking lung cancer in both incidence and death, slowly overtaking, and is going to be the #1 cancer soon. Even in females, it is slowly inching towards breast and cervical cancers, which are the commonest cancers. So it's unfortunate because it is highly preventable with a good lifestyle. We just, it's unfortunate that many of our patients had to succumb to this very aggressive form of cancer. Yeah.
What are the risk factors?
Yeah, colon and rectum are part of the intestine. So any risk factor has to be related to the diet. Smoking, alcohol intake are definitely risk factors for most of the cancers, especially the cancers that involve the gastrointestinal system. But dietary factors play a major role. Lack of an adequate nutritional content in the diet is definitely a risk factor for colorectal cancer. We need to take a balanced diet with all the micronutrients and the essential vitamins as well as the minerals to prevent any form of oxidative damage that happens to the intestine. So when food passes through the various parts of the small intestine, they have contact with the bowel wall, what we call as the lumen, bowel lumen. So there is a bowel wall on either side, and it contains the mucosa. That's the layer of the intestine that absorbs the nutrition from the food that goes through the intestines. So whenever there is a lot of toxin in the diet, whenever there is something unwanted, a lot of oxidative damage, a lot of diet-related toxins happening. So all this has a lot of contact time with the intestine, and that toxin gets absorbed along with the food. So, and this repeated damage leads to cancer formation later in life, because up to a certain level, the bowel or the body itself can repair the damage as much as it can do. But when it becomes very overwhelmed, the damage just persists on as a genetic damage, and that's the time when the tumor starts developing. So many of our colorectal cancers, when patients ask me, we really have no reason, and most probably it is a diet-related cancer where they have an unhealthy diet pattern. The other major spectrum of etiology, the cause for colorectal cancer, is the genetic syndromes. So there are several genetic syndromes which are part of which colorectal cancer is a part of. For example, we have something called a familial adenomatous polyposis coli. So that is the name of a syndrome where for generations, people will start having small polyps in their intestine that can eventually lead to colorectal cancer. The incidence in a family is almost 100%. The transmission is almost 100%. And there is a particular gene that is involved, a single gene mutation that is involved in this particular cancer. So this particular syndrome. So in case there is a colorectal cancer running in the family, so we'll have to test the patient for this particular mutation and take a preventive measure of removing the entire colon before a certain age so that they don't develop colorectal cancers. In their colonoscopy, we will be having thousands of polyps, small polyps will be there. So these are polyps that are very, very pre-malignant, meaning they will eventually turn into malignancy. Apart from this, there are other polyposis, non-polyposis syndrome. They can occur as a part of a complex syndrome, which can involve breast cancer, ovarian cancer, endometrial cancer, that is the uterine cancer. It can be a part of a big complex. So that constitutes about 5 to 10% of all colorectal cancers. For majority of colorectal cancers are environmental reasons, and our lifestyle and habits are the reason for these kind of cancers happening.
Very elaborative, Dr. Nithya. In fact, you already mentioned about genetic. Is it hereditary?
Yeah, the 5 to 10%. See, genetic is there is a small difference when you call a tumor as genetic and when you call it hereditary. Hereditary is something that runs in families. So it doesn't mean that I've had several patients who come to me and asked, there are few relatives who had breast cancer and endometrial cancer. What is my risk of developing colon cancer? So if there is no particular syndrome running in the family, so the risk is almost as of the general population. So when you call a cancer hereditary, it means that several generations of that family have been suffering from the same kind of tumor And what I mentioned, the syndrome I mentioned is typically an example. So they would have the same kind of tumor or a syndrome complex. There are a few more cancers which are involved in that particular syndrome, and that can be the reason. So that is called hereditary. So most of our cancers harbor some kind of a the genetic mutation is the starting point of every cancer. The mutation keeps getting carried on to the next dividing cells, and that becomes a huge tumor, which the body is unable to manage after a certain point of time. So there are some hereditary cancer syndromes associated with colorectal. In fact, the maximum number of hereditary cancer syndromes are associated with colorectal cancers. Although there are many, thankfully the incidence of hereditary cancer is less than 10%. So that itself is a blessing, because we would be having families of people, coming and getting themselves tested with this kind of a disease. Fortunately, it's not so common.
What are the usual signs and symptoms?
Yeah, very important in today's world. I keep reiterating that we have to listen to our body. The body has its own ways of sending signals to us that it is fine and it is not fine. Most of us feel on some days that we are not fine and there's something wrong happening, but we really don't tend to, go deep into it and find out what happened to us. We just want to give reasons for saying why, for trying to tell why we are not feeling okay. Most of the time it's work related, stress related, and we give a lot of nice names to it. So similarly, the most important symptom of a colorectal cancer is an altered bowel habit. So whenever you face a situation where you've been having constipation for a while, you've been having diarrhea for a while, and it keeps alternating, or you've been having persistent constipation, persistent irritable bowel. That's a common term used nowadays, the stress-related bowel syndrome, where they have frequent bowel movements and frequent painful stools and all that. So that many of us actually attribute that to a lot of stress that our work gives. But it could be a very sinister sign. So these kind of symptoms can be present very early, and this could be the starting symptom, because there is some irritant inside the bowel wall which is getting into contact with the stool. So whenever there is something in the bowel that hinders the movement of the bowel keeps constantly moving. All of us can actually feel it. So whenever there is something in the bowel wall that hinders the movement of the bowel, you will feel pain. That is the most important early sign of colorectal cancer. Pain during painful, there is some kind of pain in the abdomen. There could be even painless bleeding in the stools. That is one early sign. This is very, very important for rectal cancer more than colon cancer. Rectal cancer can present with fresh bleeding in the stool, which we are likely to miss. One of the main reasons I keep quoting is the presence of a Western type of closet, which we don't really tend to look at our stools so frequently. So my advice to everyone, to diagnose an early rectal cancer, you need to keep looking at your stool frequently, at least once in 15 days, once in a month, once in 2 months. Please keep looking at the stool. 1 or 2 drops of blood are likely to be missed in such cases. So that can, if you miss on that, the disease is going to go more and more advanced, and it starts spreading to the lymph nodes, to the surrounding organs, sometimes even distant organs where it's no longer curable. So that is another sign. So we have altered bowel habits, we have bleeding in the rectum, and a late feature. One of the other features, instead of bleeding, we could be having black colored stools. That could also be a sign, and this indicates that the tumor could be in the cecum or the early part of the colon, where the blood undergoes some changes and you'll have black stools. So in case someone presents with black stools, the first thing that we should be doing is to go for a stool testing. So that we don't tend to do, there is some stigma associated with stool testing even today. So that should be done. It is one of the most important methods of screening, which I'll be coming to later. So this is another symptom. In the advanced stages, we could have severe pain because the tumor starts becoming bigger. It occupies a larger space in the pelvis, inside the pelvic bone. There are a lot of organs there. And if a tumor, again, it's going to compress the surrounding structures and cause severe pain. When it starts spreading to the other organs like liver and the lung, the symptoms of a metastatic disease start happening. So they start losing weight. Once it spreads to the liver, the appetite is gone, they start losing weight, and they become very frail and weak. So we shouldn't be diagnosing colorectal cancer in this stage. We should be getting it diagnosed when there is a earliest bowel symptom. No colorectal cancer ever comes without any symptom. There are subtle symptoms which we have to listen. All we need is a little bit of awareness to find out what it's actually telling us. All we do whenever we have some kind of symptoms is to put the blame on the food that we ate the previous day. And we keep telling that there is a lot of stress, the bowel hasn't recovered, over-the-counter medications, nothing really helps. So all that we have to do is to go to a gastroenterologist, ask for a colonoscopy, and there it is, the diagnosis is done, and probably you'll get yourself diagnosed in stage 1, which is the best thing to have, because it's going to be curable without any additional therapies except for surgery. So these are the main presenting features of colorectal cancer.
That was very, very educative, Dr. Nithya. Basically, Dr. Nithya, when they find these symptoms, most of them go to their trusted GPs or family doctor. When is the right time, to visit a gastroenterologist? When is the right time?
The visit to the family physician is the first thing that's needed. So I recommend that all of us go to a trusted family physician first. Take a couple of days of medication. I'm not telling that all cases of bleeding per rectum or all cases of altered bowel habits are going to be cancer. It could be just an ulcerative inflammatory bowel disease or some benign condition. Or as I said, it could be even be related to, if it's of a shorter duration, then probably be related to recent dietary habits. But if the symptoms do not get all right within a week or 2 after they get treated with appropriate medication, that's the time you should be going back to your family physician and asking for further reference. A family physician cannot do, if he's a gastroenterologist, then well and good. If he's not a gastroenterologist, he's going to refer you to a gastroenterologist for finding out if you need a colonoscopy or a sigmoidoscopy or a proctoscopy, depending upon your symptoms. They are different investigations. I'll come to it next. So that is the time. If your symptoms persist for more than 2 weeks, that's the time you should be visiting a gastroenterologist, because you've got the adequate medication from your family physician. It's not getting all right. It's not getting better. There's something else that needs attention, and that's something that needs to be looked at. So we need a procedure for that. We need an endoscopy, and that's the time. So 2 weeks or 3 weeks is the maximum you can wait for symptomatic treatment.
What are the preventive measures?
Preventive measures, yes. Healthy diet, I always keep telling. A balanced diet is the best way to prevent any kind of disease. So we've been taught in school that, a diet should have this percentage of carbohydrate, this percentage of protein, a certain percentage of fat. And there is another component of diet which is very important, and that is called fiber. Non-digestible fiber. So this fiber content, let me tell you the importance of fiber content. What the fiber does is to hasten the bowel movement. So it allows the bowel content, the food that is getting digested, to move faster through the intestine. We call this time as the bowel transit time. The time of contact of the food with the bowel wall. I actually mentioned the bowel wall is a very important site of contact with the food and the toxins. So this contact time with the bowel is reduced when you take a lot of fiber. So the time for which the toxin is exposed to the bowel also reduces. So that's the benefit of fiber content in the diet that is generally provided by all the roughage, the vegetables, the fruits, all those things that actually give the kind of fiber that you need for the on a daily basis. So there is no need for an additional fiber intake at all. There are a lot of people who ask me they want to take additional fiber. Taking a lot of fruits and vegetables, a plant-based diet, a lot of leafy vegetables, they contain a heavy amount of fiber that really helps in moving the bowel faster, so that the contact time with the bowel is lesser. So eventually when your food contains toxins, whenever toxins are generated in your food, the time of contact with the intestine will reduce, and the risk of cancer automatically reduces. So this is very important in preventing colorectal cancer. It's not like people who take a large amount of fiber will never get colorectal, but people who don't take fiber at all, they are at a higher risk. So that is the main thing here. Smoking, yes, one of the most important risk factors for colorectal cancer is smoking. Smoking cessation is always advised, not only colorectal cancer, but many other gastrointestinal cancers, including stomach and pancreas, which are very highly aggressive malignancies, which cannot be cured easily. So that is one important thing. And just, this healthy lifestyle is definitely what is needed. And consumption of lean meat, red meat, and processed meat have been quoted as risk factors for colorectal cancer. And that also, the regular or excessive intake of this should also be avoided. Regular intake on a regular basis, it's probably staple food, but excessive intake should definitely be avoided because they have also been classified as carcinogens in various studies. So that's how you prevent. And one more important way of prevention is to get the genetic testing whenever there is a family history of colorectal cancer. So a genetic screening is definitely needed. Try to find out, we have something called the family pedigree. So whenever you go to a doctor and you get an awareness, how many people in your family have had colorectal cancer. So go to a specialist, ask them to do your family tree and find out how many people have been affected, if you're one of them. So try to get, if there are many people there, try to get yourself tested genetically and undergo all the tests and find out if you're harboring that gene. If you're harboring that particular gene, it is advisable to undergo a colectomy or a removal of the colon as soon as possible so that you can prevent the onset of colorectal. That's one way of surgical prevention. What I was talking about all the while is medical prevention, and this is surgical prevention. So this is a foolproof prevention where they remove the entire length of the colon from the beginning of the colon to the rectum. So that's what is done, and it is definitely a foolproof method of removing the risk of colorectal cancer in the patients who have the particular gene.
For example, you earlier mentioned about this preventive measures and about fiber diet. What about what about for senior citizens, old age?
Yes. So here here comes the screening, importance of screening here. Colorectal cancer, we don't have established norms for it's not we don't have established norms for screening as yet, but there are recommendations. So whenever as I said, whenever you have a family history of colorectal cancer, especially people who have had colorectal cancer, many people having colorectal cancer in a single family at the age of less than 50. So this is a disease of elderly. Most often cancer is a disease of elderly. So whenever you have people diagnosed with colorectal cancer under the age of 50, there lies the alarm. So we should be getting ourselves tested frequently. So if you're belong to that family, or if your one immediate family member has it, so the best way to undergo a screening for colorectal cancer is to undergo colonoscopy, which is the endoscopy of the colon right from the anal canal to the beginning of the colon, which is called the cecum. So that is the large intestine starts with an organ called cecum. That is the end, the junction between the small and large intestine. So that is the process to screen. So we definitely need a colonoscopy below the age of 50 if there is a family history. Apart from that, along with that, we should be undergoing what is called as the stool occult blood testing. So this is also one of the important ways of simple detection of cancers. This is not highly specific for colorectal cancer. A stool occult blood, meaning there is evidence that there is blood in the stool, although it is not visible through the naked eye. So this particular test can detect cancers of any part of the gastrointestinal tract, right from the esophagus to the colorectal region. So stool occult blood testing and colonoscopy are presently recommended as screening procedures. This is for all people who have family members diagnosed with colon cancer under the age of 50. Above the age of 50, I strongly recommend that you undergo a colonoscopy at least once in 5 years. So that is one important way of screening for colorectal cancer. We can only strongly recommend, we can't make it mandatory because there is no particular guideline making, like a mammogram every year for women. We can't recommend that in all patients. So we do it in selected patients at least once in 3 to 5 years. That is what is recommended. There is another blood test for colorectal cancer, which is called the carcinoembryonic antigen. It is a tumor marker, a particular substance secreted by the tumor. So this can also be used as it's not particularly a screening test, but sometimes may be useful in patients who are symptomatic. to find out if they are really having a colorectal cancer. But we don't recommend that as a screening procedure. So this is the thing. Let me repeat it. Any person with a family history of colorectal cancer under the age of 50, please get yourself screened. Even if you're younger, then doesn't matter. You don't have to wait till 50 years. So please go and get a consult for a colonoscopy. And you would have a genetic counseling before that, because they would be drawing your family tree and then finding out which members were affected. Above the age of 50, we strongly recommend a colonoscopy and an annual stool occult blood test done every year. So stool testing at least once a year, that will definitely help us to detect some pathology, especially in patients who have been repeatedly symptomatic. There is another condition called inflammatory bowel disease. I actually wanted to tell that, which I had missed. Sorry for that. Inflammatory bowel disease is a condition where there is a lot of colitis. It's not a malignant condition, where there is a lot of inflammation, and the entire colon, right from the cecum to the anal canal, they have ulcers, and lot of ulcerations happen. The presenting symptoms are mainly bloody diarrhea. So they suffer for about 5 to 10 years before their ulcerative colitis. That's the particular disease. It's called ulcerative colitis, and that predisposes to malignancy after about 5 to 10 years. So these patients have to repeatedly undergo a colonoscopy to find out if they have any malignant ulcers or any ulcer that is growing into a malignancy. They can also undergo CEA to find out if their markers are increasing. So these people need to be on guard. It's a rare condition, IBD, inflammatory bowel disease, but these patients need to be really very careful to find out if they are progressing to colorectal cancer. So these patients need to be screened very often.
Clarifying, and thanks for the advice, Dr. Nithya. What are the treatment options available?
Yeah, the treatment for colon cancer and rectal cancer are going to be different. The primary modality of treatment of colon cancer is surgery. So they remove the part of the colon that is involved by the tumor with a good margin of at least about 10 centimeters. The large intestine is about 1.5 meters. And if the tumor is on the right side, our right side, that's the right side of the colon, they remove the entire right side of the colon. If it's present in the horizontal part, so that part alone, and a little bit of the descending colon is also removed. So they try to give a good margin so that you don't have any kind of recurrences happening. So that is the treatment for colon cancer. And fortunately, most of our colon cancers are operable. There are very few cancers which aren't operable, and we need to give them something called chemotherapy before the surgery, so that the tumor will shrink and then they get the surgery done. So this will be the primary treatment modality for colon cancer. And if the tumor is beyond stage 2, we would prefer to give them 6 months of chemotherapy. That is mandatory. In colon cancer, we don't have much role for radiotherapy, and it's mainly the chemotherapy that happens. In rectal cancer, most of these patients require radiotherapy, which can be either given before the surgery or after the surgery. It's generally recommended before the surgery, and the same 6 months of chemotherapy is valid for the rectal cancer as well. So all this is in early stage cancers. Whenever the patient goes into an advanced stage disease, meaning they have metastatic disease, which cannot be removed by surgery at one go, like the patient has multiple tumors in the liver or the lung, and they have multiple tumors all over the abdomen. We call them as stage 4 cancers. And it is not easy to remove all of them through surgery. So that time we give them chemotherapy along with targeted therapies, which particularly are directed towards the cancer cells. So we have a couple of drugs for that. And after a particular test that is done, a genetic test, we'll find out if they're eligible for a particular type of targeted therapy, and we try to offer them to this patient for better outcomes. So technically, a stage 4 cancer is not curable, and we just try to give them some kind of chemotherapy to keep prolonging their survival and keeping the disease under control. It is possible that the disease might go into remission or it can be cured, but the chances are extremely less. So the treatment for advanced disease is same for both colon and rectal cancer. It's only in the early stage that it's different. In patients who have been relapsing frequently, So for them, we offer something called immunotherapy. So colon cancer is one of the candidates for immunotherapy. And for eligible patients, we have offered and it has given some good responses. So that is one of the advances that has been happening over the last few years. So that these are the major treatment options for colorectal cancer. It's surgery and chemotherapy for almost everybody, barring a few patients who present with very early stage disease. We don't give them chemo, and radiation for rectal cancer. And in advanced stages, it's going to be chemotherapy and targeted therapy. So that will depend upon your treating physician and what they decide upon.
Is PET-CT is mandatory?
PET-CT is not mandatory. It is recommended. It's not mandatory anywhere because we know it's quite expensive. And the kind of it's definitely cheaper here, and people have more access to PET-CT. So if the patient asks for a PET, then it's fine. Regular CT scan screenings of the chest, abdomen, pelvis can be done. PET-CT gives additional information about whether a tumor is active or not. That's the advantage of a PET-CT over a regular CT. A regular CT will tell you there's something wrong there. But a PET-CT will also give you additional information about whether whatever is wrong there is actively growing or not. So that is the advantage. It gives additional information, which sometimes will be very beneficial for the treating physician to make a decision whether to, continue therapy or stop therapy. So we recommend PET-CT for people who can really go for it because of the additional benefits that it gives in terms of the reports.
What are the common myths associated with colorectal cancer?
Yeah, colorectal cancer commonly, especially rectal cancer, spreads very early to the liver. As we know, most of the tumors of the gastrointestinal system, the stomach, pancreas, the gallbladder, everything spreads to the liver because they have a common venous supply. So it spreads very early to the liver. So that's the commonest site of metastasis. And it can also spread to other parts of the abdomen. We call something called the peritoneum, which is a covering around the abdomen. So many patients can present with bloated abdomen, full of fluid. We've seen people coming with a lot of fluid in the abdomen because of the spread throughout the abdomen. In a rare instance or in a very advanced disease, it can go even to the lung or the brain. Spread to the bone has not been very usual, but in very aggressive and extensive disease, we have seen disease spreading to the bone as well.
Fantastic, Dr. Nithya. What is your take-home message?
My take-home message, listen to yourself first. Spend some time on yourself, what I call as me time. At least spend 10 minutes in a day retrospecting onto yourself. Find out what your body has to say to you. If your body says, I've had a headache today, my eyes are burning, I've had a bad bowel, it's not getting digested properly, please put it down on some diary and note it down. I would definitely recommend this. I do this and I keep recommending that everyone does this. You have the same complaint for the next 1 week or 10 days, please go and see your physician. That's very important because colorectal cancer, with a simple observation of stool, you can easily diagnose colorectal cancer in stage 1. With a simple occult blood test, you can diagnose it in stage 1. So if we miss out on all these things, I think we are missing that particular lead time where, you can achieve that margin of cure. So please listen to your body, follow your bowel habits, whether it's normal, whether there's any recent change, find out really vigilantly whether there has been any reason for the change. Any food-related bowel habits should settle down to normal within 2 days. The bowel regeneration time is just 2 days. 48 hours, the entire bowel mucosa will shed and there'll be new bowel cells coming up, new intestinal cells. So whatever toxin has been there in your food should just go away and wash away with the old bowel cells within 2 days. So if your symptoms persist beyond that, you should be seeking for help. So that's very important. Follow your bowel, look at your stools at least once in a month, see if there's any bleeding, see if there is any pain while you're passing stools, see if you've had any abdominal pain, any unusual weight loss, any unusual loss of appetite, any pain under the right rib cage. That's where the liver is. So any pain under the right rib cage, below the rib cage, that's where the liver is, and you should be noticing that as well. Please eat healthy. Whatever you eat, please include a lot of fiber content, a regular portion, at least about 4 to 5 portions of vegetables and fruits. I always keep telling my patients, eat more vegetables and fruits than you eat rice. That's, more than half your plate should be only vegetables or fruits. fruits you can't eat for lunch. You'll eat it later. But there should be more fiber content or the roughage, something that cannot be digested. That should be more than the quantity of the staple food or the cereal that you eat. It need not be rice. It can be anything else. That itself makes a huge difference. And please inquire in your family. If there's been any history of family history of colorectal cancer, you should be really watchful for that. Just not colorectal cancer. There are families which have a lot of cancer patients, and this signals that there might be some genetic damage in that particular family, that you might be harboring that gene. So to find out if you're harboring that gene needs a very adequate follow-up with the family, and please go and consult a doctor to find out. I've had many patients who've just come and asked me if they need a genetic screening. So that's actually very nice and appreciative, because they are aware of what's happening around them. So please do that. Don't put all the blame on food and stress. That's not at all the thing that's needed right now. So be watchful, be aware, and try to, keep in mind all of these things. Please maintain a health diary. I do this whenever I do any awareness programs. Please maintain a health diary, something that's not been normal, you've noticed out of the normal, out of way. Please note it down and find out how many days that has been lasting. Be sincere to yourself. Don't deny that it has been there. So that's most important. That's my take home message. Stop smoking. Stop that's one preventable cause of cancer. So smoking cessation is very important in preventing most of our cancers. And I keep telling that at least about 40 to 50% of smoking related cancers can be prevented overall, and the incidence will come down by that much of percentage. So that is important. Healthy diet, observe yourself. That will be my message for all of you.
Noted, Dr. Nithya. Thank you so much for your valuable time today, in spite of your busy schedule, and really educating us on colorectal cancer. Viewers, Dr. Nithya recommends that people with an average risk of colon cancer consider colon cancer screening around age 50. Even if it is you are lesser than 50, please go for screening. But people with an increased risk, such as those with a family history of colon cancer, should consider screening sooner. Several screening options exist. Talk about your options with your oncologist or your GPs, and together you can decide which tests are appropriate for you. Next Thursday, let us catch up with an interesting topic. Till then, take care. Thank you, Dr. Nithya. Thank you so much for your valuable time.
Thank you so much. Thank you so much for the opportunity.
So much.